Good evening, ladies and gentlemen. This is the Community Development, Housing, and General Government Committee. Thank you for your patience. The Public Works Committee ran a little long, and then we had a little transitional time. We have, as usual, a general agenda and a consent agenda on tonight's calendar. Let me check to see whether we have items from the consent agenda to be pulled. I'll go over the housing cases individually by street number in just a moment. I am pulling C4 for a presentation. Is there anything else that needs to come up? Okay. Then let me ask whether there is anyone here to speak to any of the following properties. If you are, please raise your hand. Be sure that I see the signal. 4057 Sheraton Street, 418 East 25th Street, 118 Dillon Street, 1830 Meadowbrook Drive, 4057 Sheraton Street Accessory Building, 118 Dillon Street Accessory Building, 507 Duke Street. I've seen no hands go up. Is there a motion on the balance of the consent agenda other than item C4?
I have a question,
Yes.
Mr. Chair. And maybe I'm mistaken, Mr. Baylor. Last night, there was a young lady here, and if I'm not wrong, I think she had torn the notice off the house on Sheraton, I think, and she was wondering what she could do to prevent whatever the action was going to take place. I guess today, I'm not sure, but I'm thinking when I asked her what street, and she said Sheraton, and then she had to kind of help, me know where it is, and I do. And I did tell her that was Councilmember Burke's ward, but I told her, because your name was on the paper, I suggested to her that she call you or either Mr. Brooks and find out whatever that they needed to do to, fix the situation.
I spoke with her this afternoon.
Oh, okay.
And explained the process that we would be going through. She, I believe, thought that the city would be taking possession of the ownership of the property, and I explained the process and how she might get possession of the property and the repairs that would need to be made.
Thank you, Mr. Baylor.
Yes, ma'am.
Mr. Chairman, if there is nothing else that needs to be pulled other than item C4, I'd make a motion to approve the balance.
Second.
All right, discussion? If not, those in favor, please say aye.
Aye.
Any opposed, no. That's approved. Item C4, please.
Item C4, Energy Efficiency Conservation Block Grant Closeout Report and Greenhouse Gas Summary Update.
Thank you. I had asked for this item to be pulled because while it is not one calling for specific action by the committee or council at this time, I think that it is an important item which we should hear the status report and update on. So we have presenting that to us today.
Mr. Chairman, thank you. My name is Wendell Harden. I'm the Sustainability Program Manager for the City of Winston-Salem. And Mr. Chairman, committee members, thank you for having me tonight. As you know, we've been working the past 3 years on this grant. It is actually called the Energy Efficiency Community Block Grant, better known as EECGB. It was awarded to us back in 2009 as we were awarded $2.262 million for this grant. And in July of 2008, do a little history, that's when the city began its journey going down the road of wanting to address greenhouse gases and also along with energy efficiency and the education of both of those internally and to the public as well. So what I'd like to report to tonight is you have before you a report that's quite extensive and in detail. So instead of going through it page by page, I'd like to give you a quick summary of some of the victories we've had and some of the issues you may read through. What I'd like to talk about tonight is also the baseline that was set. The baseline was set in 2005 for this report, and now we have closed it out at 2012. So there you have a 7-year baseline period for which we're working from. And good news is, and I'm happy to report, that our electrical use by the city and its emissions from its electrical use has actually been reduced by 3,000 tons over that 7-year period. You will also notice in the report there are some spikes that have occurred. Those are usually from us having capital improvements of which we have to adjust to afterwards. The reality is that our emissions being reduced are actually based on our actions that we do with equipment and new facilities we put in as a city. Also, I'd like to say that in the beginning, as I recall, we were asked to really look at greenhouse gas reductions. I think really what we were trying to achieve was stability. And that's where we targeted making sure that we looked at the 2005 level and saying, can we maintain that stability? Well, here we are 7 years later, and I'm happy to report that after 7 years, our greenhouse gas emissions have only grown 1% over 7 years. That's based on a lot of hard work by staff, the support of council, the mayor, and our residents. What I'd like to also finally talk about are the projects that we did with 1.7 million of that grant. Basically, city facilities from City Hall to recreation centers and items and such. From our work, we have actually been able to reduce the city's electric bill by $110,600 annually. So I believe that's about a 6% reduction in our cost of energy over our time. The remaining dollars were used to educate the public with 2 large public facilities called Go Expo that we ran for 2 years. And then a real proud project that I'm proud of is our weatherization program we ran last year, where we touched every ward but one. So many of the citizens were touched with that program. So that is what I'd like to talk to you about tonight. And if you have any additional questions, I'll take them now or in the future as you review the complete report.
Mr. Harden, I may have misread something, but I thought that I was seeing in the report that there was actually an estimated 3,000 ton a year, or 3,000, actually it says tons a year reduction in CO2 emissions from the city. Is that correct?
That's actually on the electrical use emission at this point that I'm aware of.
Okay. Has
We've
that
had-
been offset by growth in other operational
Yeah,
areas?
there's been other growth that's going on. The biostryers that was put out in Eldridge plant out there brought in 5,000 tons of additional emissions that we had to reduce on. And with the optimization by our utility staff, they dropped that by another 1,100 tons, which brings that number back down towards the 3,000 tons you're talking about.
All right. So when you say there's been a 1% growth in CO2 emissions, what are you referring to?
That is if you take the total from the 3 different energy sources, the electricity, the natural gas, and the vehicle use utilization. If you look at our 2005 baseline, it was 146,347. If you look at our 2012, it's 149,072. And that was brought about, that's really only a 1% increase in total of those 3, and that's only an internal use there on those 3 sources of energy. You'll find if you go through each project, you'll find the pluses and minuses and tonnage that go through all of those. And that's why I'm saying the more detail you get into, that's how it can get more convoluted at that point.
In summary, what's created the fairly substantial increase in CO2 emissions from natural gas usage?
It was the actual biodryer usage. It came in and brought 3,000 tons on its own by going into optimization out there at the plant itself. As we go through any capital project, there may be some kind of piece of equipment that comes in. We were not a large natural gas user prior to that, but by that piece of equipment going in, we doubled the use of our natural gas.
Is there any thing in the works going forward to make that either more efficient or substitute?
Well, since 2009, sir, they've actually reduced it by 1,100 tons. They learned about the equipment. They're optimizing it, working with it daily, and they've actually reduced that 5,000 by another 1,100 tons, bringing it down to about 3.
Thank you.
Yep.
Mr. Montgomery.
It was a question in regards to looking at that 1% increase.
Yes.
Now, looking at the 7 years previous, and what was the rate of increase during that same time frame?
Well, if we're looking at 1% for 7 years, we're like 0.00125, I believe, is somewhere where that annual increase is. But if you go back and you actually look at the data, you're going to see the spikes of 2%, 3%, drop of 10%. But as we look at the aggregate of all 7 years, we notice that it's only totally not at 1%.
Well, no, I'm saying what you looked at was the 7 years at that 1%.
Yes.
But prior to that, comparatively,
It was on a 4% annual growth rate.
okay, so before the 7 years, it was on a 4% annual growth
That's
rate?
correct.
Okay, yeah.
Other questions, comments? Anything else, Mr. Crichton?
That's it, sir.
It was
I'm
one,
sorry,
one last
please go
thing.
ahead.
Now, in regards to some of the things that were done, and I don't know if that correlates with some of the other agencies or others out there, but just like you said, how you all worked and reduce the utilities for the city. Is there anything, and you may answer this or somebody else may, is there anybody working, particularly with some of the things you all did to help educate the greater public on some of those things that can help reduce that, just with the utilities?
Yeah, yes, sir. Can you remember, Montgomery, what we did is we actually had 2 large Go Expos during that time, which were really reaching out to the whole city and all of its residents. I know that Committeeman Adams was there and got to see all that was going on in education. And we spent a good 3 years educating just in a very large venue as that. And then as we got to the weatherization side, we went down and actually went to the local churches, started working with them and getting into their congregations and working on weatherization programs with them as well.
And I just want to bring it because there are a lot of things that are going on that help individuals in regards to reducing their own utilities and others. And I bring that up just after the conversation we just had prior to about with Duke Energy, that there are other things that can help the city overall with this. So I think that's good things we're doing.
Right. The city's also aware of Duke's new residential energy program that's coming online this year based on what happened at the state board. They're going to be doing a home weatherization program available to their customers as well. We've also been a big advocate, council and members of council have, of Earth Day Fair as well. And that's a big, as a large venue in which we can get the message out about what can be done locally within the home as well.
Ms. Adams?
Yes, thank you. I remember 4 years ago, I was on the Sustainability Commission, and I remember that one of the things that we prioritized where we wanted to go, and everybody agreed education was key. Ms. Wheelock, you remember those meetings? I got to commend you guys. You know, I know the going was rough. We said it would be because we're trying to change a mindset and a culture to get more engaged in how important it is to be sustainable, not just at your homes, but your environment and the community. The listing of the things that you got here listed, again, working with other nonprofits and churches for the weatherization programs in the south side of town and other areas, I think is good. And just like you said, the Duke Energy Residential Neighborhood Program that's coming up, there's going to be a kickoff. I don't want to go ahead, but September the 12th. But it's basically the North and the Northeast Ward, and we'll be talking more about that. Whereas residents, community people will be able to come and get free services that can help reduce their energy bills and that sort of thing. Everything from hot water installation wraps to heating furnace filters, polytape, caulking, you name it. There's just a long list. So I'm looking forward to see how that goes over. But again, thank you for, helping our city again. This was undertaken by a previous council before we even got here, some of us. So I can commend the vision for getting us there and staff. Thank you very much.
Ms. Harden, just one other point. Moving forward in the near term, what is the point or points of emphasis for the effort?
Currently this year, we're looking at the overall energy plan for the city. We do not have a comprehensive energy plan at this point in time. I believe that's a direction we should start going now that we've taken and developed a lot of learning points from these grants and projects that we've done that can help us develop that plan.
Any other work with regard to the Sustainability Committee?
The Sustainability Committee has pretty much looked at the EECGP funding as a stop point for them. At this point, we have to re-energize and look at saying, where are we going to, where do they want to go at this point? A lot of them have given a lot of hard work, have burnt themselves out, so they've asked to be, replaced at this time. So we're in a campaign of re-energizing that committee together.
Thank you very much.
Thank you.
We'll move now to the general agenda.
Item G1, presentation related to the Forsyth County Health Department.
And presenting here, we will have, if you'll step forward and introduce yourself to folks listening and give us your report, sir.
Good evening.
Good
Evening.
I am Marlon Hunter, and I'm the Director of the Forsyth County Department of Public Health. Thanks for having me. I have not had an opportunity to come before you since I have taken on the post 2 years ago. And so I wanted to come and talk with you about some of the programs and services at the Health Department. The Health Department has the responsibility to provide services for both the city and the county. And so over the course of 2 years that I have been here, I spent the first year making sure I understood the lay of the land, understood this community and various programs and services that both the city and the county offer, as well as spend time working with our community partners to make sure we could do the best job from a public health perspective. We have completed our community health assessment. I think the community health assessment is a valuable tool for all residents in the community, especially our local government agencies, so that we all can understand the health status in our community. And that community health assessment has 4 identified priorities. One is infant mortality. The infant mortality rate tends to be significantly high and has been for some years, and so it is an identified priority that we will continue to work on. Physical activity and nutrition, chronic disease, and as well as the social determinants of health. So the Health Department is working with all of our partners and our coalitions to raise awareness on those topics from a community health assessment perspective. Also, the Health Department is sometimes viewed as an invisible profession. You know, most folks don't think about the Health Department unless you need the services. And so when and where I have an opportunity to get out and speak, I ask, you know, that organizations not forget us at the Health Department. We provide a very significant role in the community that we all need, whether we really realize it or not, especially in terms of minimizing the spread of communicable and infectious disease. Right now, we are in the middle of a heightened pertussis situation right now, whooping cough, and our staff is working with our local hospitals and clinics and parents, and to make sure that we keep issues such as those at bay and under control. Also want to mention that we've had an opportunity to do strategic planning, go through a strategic planning process at the Health Department to make sure we are providing the best possible level of service to the community. So I've taken that opportunity now that we are done with the strategic plan to realign those services that we offer in the Health Department into 3 specific areas. And number 1, that would be community health services. Number 2, personal health services, and number 3, internal health services. Community health services are those services that are non-traditional and traditional public health services. So I have merged the Division of Environmental Health that we all know has the responsibility to go out and do restaurant and food inspections, and a wide variety of other services that we all have had a chance to learn and know about. Though that particular program is also merged with WIC, our Women, Infants, and Children program, our laboratory, our pharmacy, and as well as our dental clinic. Those are some very non-traditional public health programs I chose to merge with environmental health, because as you think about it, if you've gone to school to be a pharmacist, you may never think that you'd find yourself in a local public health department providing services as a pharmacist. So we intentionally have merged all of those departments to make sure those providers in our dental clinic as well understand the mission of public health and what it means to provide services, especially to the underserved. Our personal health services division is one that has a very significant role in this community, because we have something that's very unique that I have not seen in many health departments around the country, is a preventive health services division. In the preventive health services division, we have quite a few public health educators. You know, those individuals get out in the community and talk about various chronic disease topics, whether it's sexually transmitted diseases, teen programs, teen pregnancy, a wide variety of education-related programs. We have health educators that work with our nurses and our clinics. And a lot of the funding all come from the same pot from both the federal and the state government. So why not merge those programs, streamline what they do every day to make sure that we can give the community the biggest bang for the buck? So when our clients come into our clinics, we have health educators sometimes who can spend more time than our clinicians have time to, answering questions and making sure that individuals understand how to take advantage of the services we offer, and most importantly, how to take care of their health and the health of their family members and their, and their children. So we have merged both preventive health services and all of our clinic-based services, and they are all under the umbrella of personal health services. And then finally, we have an internal health services division. They really focus on our day-to-day operations. We have our health department is fully accredited by the state, and which is great. We have standards by which we operate our day-to-day business. We have our IT staff, we have business and finance, we have epidemiology. All of those individuals, patient registration, interpretive services, all work in the internal health services division to make sure that when folks come into the health department, they're getting the best possible services, and as well as making sure that when our staff are out in the community, that they're getting the right messages. So that reorganization came as a result of our strategic plan, and I'm hopeful that after really spending time with the staff, understanding their strengths and their skill sets, that we can do a much, not that the staff were not doing a good job, but they can continue to do a much better job moving forward in the future. So that is basically what I wanted to come and share, and to just say, don't forget us at the health department. We're here to serve you here in the city and the county, and we're delighted to be a partner with you.
Thank you, Mr. Hunter. Ms. Adams and then Mr. Taylor.
Thank you, Mr. Hunter. Just a couple of questions. Are you from here? You're not from here?
I grew up, I came here from Tallahassee, Florida. I managed 2 health departments in the state of Florida, but I grew up in Spartanburg, South Carolina.
Okay.
So I feel like I'm back home.
All right, the Carolinas, we'll take you. We're on you. What I wanted to talk to you about, everybody knows me, I'm pretty big on fitness, and I've been that way probably 40 years of my life. Mm-hmm. One of the issues that I see in our community, we have so many great intentions, but it seems like everybody is off doing their own thing. And I'm not seeing the needle move when it comes to the personal health of the citizens of Winston-Salem. We got, I don't know how many programs, nonprofits, the hospitals, and I just like to see somebody pull that group of people together, and it may be you. Some of them have data, some of them don't. Are we moving the needle? I see all the money being thrown at it, fitness, food, but I haven't seen anything to say that we truly are a healthier community. Now, if it's based on the organizations, we probably could be a healthy community because we got enough of them now. But I'd like to see someone take the reins and pull the group together and work together to really, as you just said, get the best bang for the buck and focus on maybe a certain group. And I know they're the ones, they have their groups they focus on, but maybe fresh eyes can tell them that, well, maybe we need to do it this way, and we'll really see how families' health are improving in the community. That's a request from me.
Yes, and that's a wonderful request. And that, I would say, what you just said is the same issue that's brought up all around this country. The needle's not moving
not
in the
moving.
right direction. It's moving in the wrong direction. And, but what I do find that's very unique here in Winston-Salem, and perhaps we can all find a way to make it stronger, is that we have coalitions at the health department. I believe in coalitions. They work if you work them. And I think that, you know, as I just mentioned, we just have 4 identified priorities in our community health assessment. So I want to encourage, and if you could help me encourage, or perhaps, you know, get us in contact with individuals who would be interested in working on our chronic disease coalition, raise awareness about chronic diseases, hypertension, obesity, heart disease, what that means to our community. You know, that would certainly be helpful, as well as physical activity and nutrition. We have coalitions that are chaired by community partners, healthcare providers, and but we're all singing to the choir. You know, we would like to have some community members on those coalitions.
Okay.
That's one of the reasons why I wanted to come here today, is to try to help stir the pot a little bit, to say, you know, can we get some more participation of individuals on those coalitions to help raise awareness. One other final point I'd like to make is that we are just in the infancy stages of putting together a faith-based coalition. We want to work with all of our churches and have them. We have 535 churches in Winston-Salem. Would like to have them work with us to raise awareness in some way, shape, or form about our community self-status. So as much as in as many ways as possible as we can get that word out and to get participation would be very helpful and appreciated.
Mr. Taylor.
Thank you. Mr. Hunter, you mentioned in your comments an increase in pertussis, I believe, or whooping cough. What can we do as a community to, one, bring more awareness to the situation, and two, prevent the spread further than it already is occurring?
Well, you know, I've been working heavily. I've always worked with Wes Young, with Winston-Salem Journal and all of our news stations. When we have issues, we try to make sure we work quickly to get that word out to the community. We send out press releases to all medical providers in the community. We've taken it a step further to work with caregivers, daycare centers, because it is the children that are most vulnerable. So we're doing everything we can from a public information standpoint to get the word out to those individuals who have the greatest risk for even spreading it, and that would be our adults. Now, we have identified around August or September as the time where we have heightened pertussis cases, not just here in Winston-Salem, but all across the United States. School is about to start, and you know, where large numbers of individuals congregate, you know, that's a great time to get some information out. So I'm working with our staff at the health department to say, be aware, we already have high numbers, more than 70 cases, plus cases we've identified since January this year. The vaccine still remains the most preventive way, I believe, in vaccine preventable diseases. It's still, although it is not 100% effective, at least it provides some level of care or barrier of protection against our children. So that is how, you know, we can, what we're doing to raise awareness. We can certainly work with you and other folks to get the word out, but we really want to make sure we're touching on those, in those high pressure areas like school starting, to make sure we, you know, adults know, because adults are the ones who spread it the quickest.
Well put, and if I may, Mr. Chairman, I participate every year in the infant mortality walk. And as you know, before you came on board, infant mortality has been really a significant problem in Forsyth County. What are we doing to work on infant mortality? As a father of 3, that's a subject that is very important to me. And so, Mr. Hunter, what are we doing to work on infant mortality here in the county?
You know, infant
And the city.
mortality, you know, I grew up in South Carolina, grew up in the South. I've worked in public health in Tennessee, North Carolina, South Carolina, Georgia, and Florida. I've just about covered the Southeast over the course of 20 years. And I would say education is key. We all know that for every 3 white babies that are born, one out of every 3 African American, 1 out of every 3 babies that are born die to infant mortality to the African American community. And those numbers are very high. No, excuse me, 3 to 1. I got the numbers transposed. You follow me?
Well, it's a
3 to
significant
1.
problem in the African American
So
community.
it is a significant problem in the African American community. But here's one thing you should note that's even more significant is that African American mothers, whether they live in poverty or whether they are affluent, still experience significantly high numbers in the realm of infant mortality. So is it physical activity? Is it nutrition? You know, what are the contributing factors to infant mortality as it relates specifically to African American moms? So, you know, we have programs at the health department designed to educate African American moms, but at the same time, we have to really work to streamline more resources toward infant mortality as best we can. There was one great example I'd like to share with you in Atlanta. I can't repeat the name of the project, but what we have found is that that for a mother who has a great social network, you know, support, individuals who can help them get to their doctor's appointments, individuals who's making sure that they're taking their folic acid and their medications on time. Those mothers that have strong family and social support have the best health outcomes for themselves and for the baby. I believe there's a program in Atlanta where 100 families adopted 100 moms who were at risk for infant mortality, and 100% of those mothers had positive health outcomes as well as their babies. So what that says to us, no matter what I would say research we've done or medication we've tried to identify or what social determinant that we may try to label as a problem, family and the social network is key for improving infant mortality. So somehow we have to make sure we improve on that for our mothers who are struggling and need assistance to improve that outcome.
And my last comment is what you do is a thankless job. And we've mentioned several important issues that are relevant to our community. What you do sometimes is thankless. Nobody talks about it, but you know it's a valuable resource, and what you do in the community is very appreciated. I just want to say thank you for coming to this committee. I'm not the chairman, but I can say thank you for coming to this committee and sharing your thoughts and ideas on how we'll move forward as a community.
Thank you.
Mr. Montgomery.
I won't belabor too much more, but again, it's thanks to you and what you do. But also a question in regards to have you identified any particular resources within the city that we can help to leverage to move these words, such as is there any current partnership with TV 13 and other resources like that to help get out some of the information that you all have?
Is that our government channel?
Mm-hmm.
You know, I got invited early on as a partner with emergency preparedness to come in and speak as a partner. But certainly if there's an opportunity to get out and speak more about these issues as it relates specifically to in public health, I'd like that opportunity.
Well,
Yeah.
I think,
On a
City Manager, I think it'd be, if that's within the guidelines of what we can use TV 13 for, I think that's an essential part in helping to spread word of things that are happening, particularly with their information, if it's not already happening.
Councilman Montgomery, it is within the guidelines. We used to do more partnerships with county agencies. I think it's been several years, the county administration basically stopped funding, paying for any of the costs to produce those shows. But we can see what we can do, talking with the health department, and see if they've got some funds for any direct costs that we might incur to produce those shows.
And when my talks start back, I'll be sure to bring that in.
Mr. Hunter, you went over the community health assessment and mentioned 4 priorities. 2 of them were infant mortality rate and social determinants of health. In either or both of those areas, have you noticed one of the factors that you see a correlation between health status is the coverage by health insurance by individual? Is there a correlation between whether an individual has health insurance coverage and their health status?
Good question. We typically provide services at the health department to the underserved. We don't provide primary care. We strictly provide public health services. So we're not ear, nose, and throat kind of health care providers. And a lot of the individuals that come to the health department represent those individuals who are on a sliding fee scale and live at 200% of the poverty level, and typically get those services for free, especially as it relates to sexually transmitted disease. So in terms of providing services to individuals who have health insurance and benefits, we don't. We do in the realm of dental care, but we only provide dental services to individuals who have dental insurance. So, but what I can say is, to answer your question directly, no. But what I am fully aware of is that for those who have minimal levels of care, just based on my 20 years of experiences within the public health and healthcare realm, tend to have better health outcomes, when they receive basic services, like physicals, if they have colds, what to do, how to take care of themselves, and apply it. We see better health outcomes for those who have minimal levels of care and access to care.
Was the community health assessment just of folks who walk through the doors of the county's agencies, or was it a more broadly based assessment?
The community health assessment was conducted for everyone that lives in Winston-Salem, Forsyth County.
And did it include as a factor assessed the percentage of individuals who had health insurance coverage, one type or another?
No.
Okay. Professionally, would you consider it relevant to individuals' likely health status, whether they had health insurance coverage and thereby got regular checkups and preventive care?
I do, and I'll give you one quick example why. In terms of dental hygiene, we all know that poor dental hygiene is a major contributing factor to many chronic diseases, to include heart disease. So, and that when children are born, if they don't receive cleanings, screenings, dental sealants, the likelihood that they will have healthy outcomes just related to dental care, we already know statistically that their health outcomes will be significantly worse than those children who've been in a swish and spit program or in a program where they've received dental sealants. I have a child as you mentioned, and I've made sure to get her in to just those basic levels of care, and providing those basic levels will certainly improve quality of life and health outcomes. That's a fact.
Thanks. That sounds like an excellent example. The reason I asked that particular question now is it had just been brought to my attention in the past couple of weeks that there's going to be an online training or seminar or workshop program made available in the next month or so for local governments on the provisions of the Affordable Care Act that are coming into play this fall and in January, and how local governments can increase community awareness of the opportunities that are coming up. I wondered if you'd gotten that notice.
I have, and I've worked with our county manager and will work with our county manager, even if it's us at the health department, to see how we might be able to participate in providing that information about the healthcare exchanges, how to gain access and learn how to use them, you know, what it means to select a particular level of care that will be provided. When and where we can be make ourselves available to that, we will.
Could you copy us with information on how we might use our educational resources to help spread that information? Work with you on that?
Absolutely.
All right, I'd appreciate that. Thank you.
Thank you.
Thank you very much, Mr.
Thank
Hunter. We
you.
appreciate your time.
Thank you.
Thank you.
General agenda item number 2, please.
Item G2, consideration of items relating to electronic sweepstakes operations. A, ordinance amending the Unified Development Ordinances to add electronic sweepstakes operation as a use, and B, ordinance amending Section 34-12 of the City Code relating to electronic sweepstakes operations.
Thank you. Mr. Contes.
Good evening.
Good evening.
At the direction of this committee, the City Attorney's Office, in conjunction with planning staff, has drafted a revision to the Unified Development Ordinances to create and define the electronic sweepstakes operation use. I'll briefly go over a few of those pertinent provisions, and then we'll open it up to any questions that you may have. As a principal use, it is recommended that electronic sweepstakes operations be allowed in the following zoning districts: highway business, general business, central business, mixed use, special use, major retail business, special use, and entertainment. As an accessory use, it's proposed that an electronic sweepstakes operation be limited to the use of no more than 2 electronic sweepstakes machines. Finally, the amendment has an amortization provision which would require the non-conforming electronic sweepstakes operations to comply with the ordinance within 2 years of the effective date of the ordinance. I also want to draw to your attention a couple of handouts that I passed up earlier. The first handout addresses the proposed zoning districts in which principal use electronic sweepstakes operations would be allowed as a principal use. Although it can be subjective, the planning staff has ordered these zoning districts from least to greatest impact for your reference in the event you wanted to consider some further action. Additionally, I have a spreadsheet. I will say this is constantly evolving as these uses either go away or pop up, but to the best of our ability, we have listed those electronic sweepstakes operations which are either currently in use or imminently will be opening. Those locations which I have highlighted, at least with respect to the ordinance as it stands, as it's proposed today, those highlighted addresses would be rendered non-conforming if this proposed ordinance were to be passed.
And the only thing I would add is that by becoming non-conforming, they would basically have to discontinue on or before October 6, 2015, based upon the current draft of the ordinance, text amendment.
Thank you. Ms. Adams?
Yes, thank you. I guess I just need some clarification. Are they non-compliant, or are we doing something that's non-compliant to the state, and what have they done? I know it's in here, but it's kind of like what we went through last week or whatever, the last meeting about non-conforming areas and that sort of thing. But I guess what I'm asking Attorney Carmen is, can we do what we're getting ready to try to do?
I guess the problem we have is sort of twofold. Yes, there is a court decision that says that clearly some operations are illegal. But as a result of that court decision, basically, a number of locations shut down and updated their software, made other changes that, based upon our review and discussions with the district attorney's office, it seems that there are some that are still legal. And it's those categories, we call them the pre-reveal. If they have the pre-reveal machines, it's believed that those are still legal. So the question now becomes, if they're legal, then where should they be permitted? In which zoning districts? And the question came to me initially in terms of the PB zoning district. Are they compatible with that district? Are these current pre-reveal machines, parlors, compatible with that district? So that's what we're trying to address right now. Those that are legal, that collectively, my office, district attorney's office says we can't shut them down, how do we address where they can be located? So that's what we're attempting to do today.
Okay. And
Does
one
that
more
answer your question?
Yes, and the part of the draft of saying that we're limiting them to no more than 2 electronic sweepstakes. I guess, again, can we do that?
That's an accessory use, and I think there is at least a reasonable basis for saying as an accessory use that, yes, we can limit them to 2.
How many have they had? I mean, do we know that kind of information? I mean, are we talking about sweepstakes parlors with 10, 15 machines in there? Or, I mean.
I'll let Mr. Contos, he's done
Thank
the
you.
survey.
And let me be a little more clear in case there is a loss here in the translation. The limit to 2 electronic machines is only with respect to that electronic operation use as an accessory use. A real-world example would be at a gas station, wherein that activity is not the primary principal use. With respect to the parlors, as you mentioned, where, again, an everyday use or
That is the main use.
that is the main use. It's a parlor. You go in, there are computers. At least as the draft stands today, there is no limit as to machines.
Right.
Now, in terms of a survey in the city, as an accessory use, there are as few as 1 machine at a location. In terms of at a parlor, I believe the highest that I've come across is 108.
Why? Wow.
Where was that?
That's a lot.
I think that was Mr.
I
Taylor.
believe it's the former King's Plaza.
And now, Mr. Taylor, you had a question.
Well, yeah, I raised my hand earlier. My question was exactly where Councilmember Adams was going about the number of sweepstakes machines. I mean, how do we define them? Are we talking about actual machines, computers? But I think you've given me some clarity there.
Yeah.
But I do like the idea of adding the electronic sweepstakes operations as a use. I think it closes some of the loopholes that some of the operations have been able to slip through. I would just ask that whether you agree with them or not, I think the state has said what we can do and what we can't do, and we have to comply. And all we can do is try to add regulations where we can. I would ask that we keep a close eye on these sweepstakes operations and make sure that they're paying their taxes. And it would be paramount to me in the areas where sweepstakes operate. If we're able to collect taxes, I'd like to see the tax dollars go back into those communities. What we're seeing here is the certain zoning districts where these sweepstakes operations will be allowed, you'll see them being relegated to certain communities. And I would ask, if they're allowed to operate, let's collect the taxes, let's make sure the taxes stay in those communities. And we know where they'll be. But until we can do something about those, I say we make lemonade out of lemons.
I have some inquiries and some suggestions. You've recommended, as a part of the ordinance for our consideration, that sweepstakes operations continue to be allowed as an accessory use. There are a number of uses that we allow in the city that we do not permit as accessory uses at all. Isn't that correct?
I will defer to Glenn Simmons of our planning department.
Councilmember Bessie, I can't speak for the inspections departments. I don't know exactly where there might be accessory uses. I don't know of any accessory uses that are outright prohibited as an accessory use. It's a judgment call with respect to what is the principal use and what might constitute a usual and customary accessory use in that type of operation. I can imagine certain uses that might not be considered an accessory use, but I don't know that there are any that specifically that are not allowed as an accessory use.
Yeah, I'm trying to think of what I would consider to be a fairly obvious example.
Service station.
Pardon?
A service station? No?
Yeah, I mean, a restaurant with drive-through service would not, I can't imagine that being allowed as an accessory use to
No.
anything else.
Yeah, there may well be, and if one were posed as an accessory use to something, that it may well be construed not to be acceptable. I just don't know of a specific use that is not allowed as an accessory use. It's not to say that there aren't some I'm unaware of, but I'm just speaking on behalf of what I know from the planning department. There may be others from the inspections department, for example, where they've had enough examples of that type of thing that's come up where they would say that that's not an accessory use. I just don't know that for a fact. I can certainly find that information out for you.
Why don't we bring that back?
Yeah,
Specific answer.
I'd like to see that. Before I move to another set of questions, in terms of procedurally, was it anticipated that this would come forward to the full council as a recommendation before it goes to the planning staff?
No.
So if we don't make a recommendation to planning staff today, then that slows down the potential speed of action on this.
Yes.
Okay. Let me ask, is it common for something to be be named under definitions and allowed as a principal use in certain categories, certain zoning categories, simply have the statute, not the statute, have the ordinance silent on the question of whether it can be allowed as an accessory use?
I think that's pretty much the way all the uses are now. They're silent on that. And it's really the more general discussion or description of is it usually and customary use as an accessory. That's my understanding.
Okay. Thank you. The definition of electronic sweepstakes operation, there was one point of possible concern there. If you get to the fourth line of the definition, the clause, and where cash, merchandise, or other items of value are redeemed or otherwise distributed at the location where the electronic sweepstakes operation is conducted. I seem to recall some question in other contexts about whether the prizes were actually redeemed at the location typically, or whether you got like a chit or a voucher or something that you'd then turn in later. Is that a question?
I'll
I'll be happy to look into that a bit more. My initial answer to that would be that voucher itself has some value to it, and therefore it would fall within this definition.
I'd like to be sure that that's not a loophole.
Certainly.
And finally, I had raised in previous discussion the question of whether the council might be interested in being more restrictive in terms of the zoning categories in which the operations would be permitted beyond simply excluding them from PB. It seems clear to me that there is nothing about the nature of an electronic sweepstakes operation that makes it particularly suitable to a pedestrian business category. This is an entertainment activity in which you would typically have drive-in clientele. It's not a neighborhood-based service. So to me, there is no controversy about the question, personally, there's no controversy about the question of excluding these from the principal uses in pedestrian business. To me, the question is, how much further should we go? If I were sending something simply on my motion to the planning staff and the planning board for consideration, frankly, I would send them something that said simply, this is an allowed use in highway business, period. I would exclude all these other categories. Again, because I think that this is a drive-in clientele. It's not a neighborhood-based service. You're talking about longer stays, not a drive in and out like a convenience store. We're talking about later evening operating hours, a relatively higher level of impact on nearby residential users, nearby neighborhoods, nearby residences than other kinds of uses that are typically allowed in close proximity to residential areas. And I think we're on very sound land use planning principle to limit these uses to the extent that they are legal under North Carolina state law to the single category of highway business. I don't know if there is interest among my colleagues in being that restrictive, but I'm going to propose it for discussion. Mr. Taylor?
I think that's an excellent suggestion, Chairman Bessie. I guess my support would be based upon a question that I want to pose to the staff. And Mr. City Manager, I know that I'm out on the limb here, and I very well admit that. But I guess what I'm proposing is that if sweepstakes operations are allowed in our communities, are we able at the end of the year to collect the taxes and maybe earmark funding for revitalizing urban commercial areas programs and giving back to the communities in which these sweepstake operations take from? And if we're able to do that, then I would be reluctant to support Mr. Bessie's suggestion. But if we are able to do that, I think we should leave it as is.
Councilman Taylor, a lot of the sweepstakes revenue has not been appropriated versus, what we budgeted is a lot less than what we estimate for this current year because it's been, we have been unsure of how many of them remain legal. Council could, and we'd have to come back and go through the Finance Committee, but I believe you could say you want to take some if not all of those revenues and earmark it for programs like RUCA if council wanted to do that.
Well, that's actually exactly what I'm proposing. So I'd ask that you look into that and bring me some information on whether or not we can do that. And I don't know if that's contingent upon what we do today, but
Actually, I would consider that to be an entirely separate question that would be within the council's purview. I wouldn't necessarily bet the farm, as it were, on a presumption that a majority of our colleagues would concur with that recommendation. I would be concerned about it perhaps encouraging excessive reliance on the revenue stream from an activity that is the subject of continued pressure at the state level for prohibition. You know, I'd be reluctant to set up a situation where one of our major economic development activities were even significantly dependent on that revenue stream. But I mean, certainly you can bring that up for discussion. I wouldn't bet on it though. Ms. Adams, did you have a query?
No, I guess I don't. At some point, Attorney Carmen, the state, I thought, was coming after this money. I thought there was some movement.
And you're correct. There was a bill introduced basically to address the sweepstakes operations and provide for state revenue and some portion of that to basically be returned to or allowed to be captured by municipalities. That bill is still out there. It didn't go anywhere in the long session. I'm not sure what's going to happen in the short session. I don't have a crystal ball, but I would not be surprised if that bill, if not in a short session next year, the following year, does not get traction.
Yeah, I would add to that too that a lot of the revenue items were sent to a study commission for next year for business privilege licenses, which this is arguably is. So it is potential. I think there's real potential that the state could capture this revenue in the future from us.
Which would be another point of uncertainty is if the state elects to either take it themselves or simply to prohibit the taxation, then we'd lose that. Yeah, General Assembly has been all over the map on revenue this year.
The current draft of the bill would allow us to basically capture, for the most part, what we've collected short of, I think it was about $89,000 when I last did the calculations. We're probably in the reasonable range in terms of what we assessed.
That would be if the General Assembly permits local governments to continue
Right.
to retain the revenue at all. That would be
Right,
one version of the cap.
right. And that's the version that's out there right now.
All right. Mr. Taylor?
Well, right now, from what I'm hearing, is that we still have the ability to capture what we collect. And what I'm saying is, until the General Assembly decides to take that ability away, I don't think we rely on the funds. I think that we simply just capture the funds, and instead of these sweepstakes operations continuing to suck the life out of my community, let's use some of that funding to give life back to our community, and that seems to me to be the only option that we have right now.
Actually, I'm proposing a different option, and that is to keep these operations from impeding on so many neighborhoods quite so closely by limiting the category in which they were considered an acceptable use to the highway business category. Let me ask, would it be possible for us to send forward two versions? One with that simply prohibited, in effect, the use from pedestrian business, and one which went to the other end of the spectrum and simply said highway business is the only one in which these were allowed.
I was actually going to make a suggestion, but we could do that. I guess with respect to limiting the use only to highway business, I've not actually done what I consider an analysis to say we truly have a reasonable basis for doing that. I've looked at the PB, because that's what initially came to me. And I feel comfortable moving forward with it in terms of not allowing it in the PB. So I'd actually, if you want to consider the HB, ask that you have two different versions for that reason. Give us more time maybe to look at just the HB.
Yeah. And I would be happy with that as a proposal. The reason I would like to see a more restricted proposal go forward as part of the package for consideration is I know that if we send the very limited proposal only to planning, then we cannot make it stricter. If we send a more limiting proposal to planning, we could loosen it up when it came back to the full council. I would like to recommend that to the committee for consideration, that we send a couple of alternatives forward for consideration. One in which all we do is limit it out of the pedestrian business category, and another in which we go to the other end of the scale and restrict it exclusively to highway business. We could then, if we choose to act on this when it comes back to us, we can pick something in the middle, or we can go to either end. Ms. Carmen.
One more comment. And I guess this was just after the fact. We looked at the PB, if you look at your spreadsheet, we looked at the PB districts, but also in discussing the PB districts, we looked at like the LB, the GBS, HBS. So those that are highlighted based upon the current version of the ordinance would be non-conforming. So it really does touch upon more than just PB. So do you want PB and then maybe a second version that says PB, HBS, LB, GBS, and then highway business? In other words, 3 versions.
No, actually, I'm satisfied with the one you brought forward. Then the what I'm proposing is the more restrictive one for consideration. Mr. Taylor?
Councilmember Bessie, I think my final comment will be this. I think there is a way to do both. I don't think it has to be either or. We can be as limited and restrictive as possible, but yet still work on the concept of capturing and capitalizing. I mean, so I guess I'm perfectly okay with your suggestion, but I still don't think we abandon the ship here. I think we've got an opportunity to kind of work to redevelop our communities and keep tax dollars where they're spent. But I don't think we'll abandon that ship because we want to be restrictive and limited. I think we can do both.
We would not preclude the option of directing the revenues from this source to a given use such as RUCA by being more restrictive in where we allow the uses to operate. That's true.
Fair enough.
Ms. Adams?
Yes, thank you. Are these all of the sweepstakes operations?
That we are aware of based upon our last inventory.
Okay.
Now, that doesn't mean we know all
Yeah,
of
because
them. But
this list to me looks a little slim compared to what I think, you know. I
Right.
just, and unless, like you said, some of them have closed down.
Now, I was going to say, about 2 years ago, we
Yeah.
had about 50.
Right.
And with the changes in the law, more recently, we had a number to close. So
Okay.
that's why the list is shorter.
Okay. Okay. Thank you.
And I might also add that now with the new fiscal year, we're in the process of capturing all the new ones, and I'll be updating that.
Okay.
That's one other question that frankly I think may be legitimate to look at, and that's the stability of the operations. If they are opening and closing at unusually rapid rates, and they appear to be, then that's more likely to have an adverse impact on the area in which one operates than a more long-term stable use.
I think they only closed in response to the court ruling and this distinction between pre-reveal and not, and what it was going to take to upgrade the machines to address the issue.
But it does not appear to me, with imperfect foresight, that we're likely to see the end of that judicial uncertainty anytime soon. So even again, under purely land use principles, it can be destabilizing to a local commercial district. Ms. Adams?
As Councilmember Taylor, I have one more comment. I have no issue with people making money, owning businesses. My issue is when it appears, and that's perception, that it appears to look like payday lending type, isolated to certain areas of the city and the community. That's where I have the problem with it. If this is all we have presently outside of the new list that we might get, over half of them are on the north side and the other half on the southeast side. I just, and I pass by these institutions, and some of them have the cash machines outside these places, and you just see this steady stream of people coming out and going to get more money. It's kind of like a miniature Las Vegas type deal. Again, I just want the citizens to know that no one on this council is against people making money and having businesses. It's just that we want you to understand that we want it to be the right way and not preying upon the poor people, the unemployed people, and those people who only have a few dollars anyway. And and I know some people would say, well, we can't control that. I understand that. But I still believe that we have a responsibility as a humankind to not prey on those people who have no other options or choices but to every day go and give my money away thinking that there's going to be a rainfall, you know.
And I would suggest another one of the factors we might look at in terms of the land use impacts is the potential adverse impact when this use clusters in an area. That's certainly, I think, relevant to the impacts on the community as a whole and on nearby residential neighborhoods. If I may, I would entertain a motion that we send forward to planning consideration two versions. One, the one presented by staff, and one, the one presented by staff with the two changes that we don't specifically address the accessory use question, and that the only zoning district in which the electronic sweepstakes operation be a permitted use is highway business. And of course, going forward with that second version permits us a range of selections later. It simply puts everybody on notice that it could be more restrictive coming through the process.
One other point, if I might
yeah.
make. If you look at the draft before you, we said that the use for the amortization schedule has to be discontinued on or before October 6, 2015. And that's actually after the privilege license is paid for. So instead of prorating that privilege license, I would propose that we change that date potentially to June 30th of 2015, just to make it easier for revenue.
That makes sense. Is that acceptable? All right.
Acceptable.
And then the other point would be that you're going to take a look at the definition language and make sure that we're not creating a loophole with that payout.
Okay,
Correct.
we will.
Is there a motion to the effect that I just outlined?
Question.
Yes.
Now, this goes to the planning board for consideration, then it comes back to this committee, or does it go back to the full council?
It normally goes back to full council.
But we typically, when there is a complex or controversial area, we'll send it to committee for
We bring this one to
review.
committee.
Want to come back
Well,
to committee, we can.
I would suggest that it comes back to committee. And when
Okay.
it comes back to committee, I'd like also information on the directive to set up a economic development fund based off the taxes that come in on these facilities.
If Ms. Traylor, you're prepared to make that as a package motion, I would recognize that.
So moved.
Is there a second?
Second.
Is there discussion? Not. Those in favor, please say aye.
Aye.
Aye. Any opposed, no. That's unanimous and moves for thank you very much.
Okay.
Thank you.
Thank you.
General agenda item number 3, please.
Item G3, resolution adopting the proposed Southeast Winston-Salem area plan bounded by US 52, Business 40, Salem Lake, and Interstate 40.
you.
Recommended by the planning board.
Thank you very much. And presenting, we will have the planning department representative, sir.
Now, I'm not totally sure how to make it work.
There you
There we
go.
go.
There you go, magic. Just wave your hand.
So it is?
And the folks watching, if you'll introduce yourself.
Now it
and
is. Mr. Chairman, thank you very much. Yes, the planning board recommend approval of this plan, and so I'm just going to give you a brief overview. It is one of the 3 that we did last fiscal year, Tobaccoville, which has been adopted, the Southeast Forsyth County, which will come to you next month, and Southeast Winston-Salem. General boundaries for the area are on the west, US 52, on the south, I-40, on the north, the railroad tracks, and to the east, Salem Lake and back property lines. So we do what we typically do with the area plans. We had an extensive citizen participation process. We had a wonderful kickoff meeting. Councilmember Taylor attended it. It was very alive. It's one of the best meetings I've been in, for area plans. And after that, we had 2 more meetings and a drop-in session, and they were well attended, and we got a lot of comments from the community that helped us develop the plan. It is an update. So the plan was done almost 10 years ago. So we look back at what has changed, the development patterns, what is new in that 10-year period. We look at that, some of the changes, as I said, in different areas, housing rehab, some positive changes, although more is needed. But I think the biggest change that we found was because of the RUCA program, many of the properties that have been improved, and that in turn, it's creating private investment in many of these areas. So that's a big change. Again, it is an update, so we had many of the recommendations from the previous plan. There were few areas that we had to revisit. There were issues, concerns from the community, so we revised those and made the recommendations. We did not have on the original plan the concept of activity centers. This was the first plan that was done after the legacy was adopted, so we did that this time. But as I say, we had a little more time to work on the plan because many of the land use recommendations were still in place. So we look at each one of the activity centers, but we decided to spend a little time on key properties. We keep on hearing from the citizens, give us a vision of what this could be developed in the future, or can you show us a photograph? And so we did that. We took a few pieces, particularly this one. It's an empty, vacant lot. It's surrounded by properties that have been fixed using the RUCA money. And so it is really in the heart of that. And we heard many times, we like to have more restaurants in the area. We like a park. And so we're just providing an idea, a vision for how this development may take, this property could be developed with a restaurant, an outdoor seating area, maybe a private park, which is something that's been discussed, and did some renderings showing, possibilities. And they were well received. We were a little hesitant, to be honest, on going on that, but I think the community really responded to that, saying, that's the kind of work that we would like to have more often. Took another piece of land a little farther south from here, which we know it's going to be rezoned, but if it's rezoned, we would like to see it developed differently. We heard from the community that the Dollar General store, it's a good infill, a commercial infill, building pull up to the street, and so rather than having your typical development, which is next to it, showing the possibility of putting the building up to the street, putting the parking lot on the back, creating a corner, using some of the existing features, trees, retaining wall, and again, just providing a vision for how this may be developed that responds much more closely to what the community would like. Focal points have been discussed. Many of the activity centers have those, and the whole idea of this particular one, Thomasville Road, could be closed in certain occasions for events in the community. That's an idea that has been thrown out for quite a few years, and some work has been done, so we recapture that on the area plan. We look at properties that are at the edge of these activity centers that are impacted. The one with the asterisk, the I and the J, those are houses impacted by commercial development on the other side, and so allowing the possibility to change the use but retaining the structure, because this is a historic area, this particular one. All the houses surrounding it are on the National Register of Historic Places, and so it makes sense to provide an opportunity for changing, but also keeping the structure. We heard from the community many times that they have a key piece of history in their community, which is the Nissan Wagon Works Complex, and so we look at that and the surrounding commercial area, seeing what could be developed in the future. It's a great asset to the community, but it is sitting vacant right now. and so provided some general direction as to additional retail or commercial development, and just did a rendering of how it may be developed, again, to just give ideas of how this can happen in the future. The last one, that's another activity center, and a lot of money has been gone into the Southeast Plaza, and it has changed drastically. Really, it's a big change. The portion of the shopping center looks great compared to the old one. So we included all of that and had a number of special land use conditions for properties all along, which is typically what we do in the area plans. But just wanted to show you a little more what we think it's going to happen since we're doing these updates. We're going to be taking more on properties and developing concepts for those. Transportation, the two main roads that are in the transportation plan, Salem Creek Connector, which will be happening soon, and the 311 connector, but most importantly, developing sidewalks, connecting the hubs in the community. In terms of community facilities, this area has a good number of parks and greenways, recognizing the Quarry Park and the Flat Rock Neighborhood Park, the private park, and how you connect those to the rest of the community. We look at that in the plan. Historic recommendations, when we did the 2000 plan, there was no historic district. Now the area has the Watown Bellevue Historic District. It covers a large area of the historic section of the community. And so recognizing that, many of the recommendations, look at preserving the character that has that the community has, but also looking at the future. Architecture from the 1950s and 1960s soon will be historic, and so looking at those sites and see what can be done to start protecting them. So that's a quick overview of that. Councilmember Taylor, we appreciate your help on getting the word out and working all the recommendations. So I'll be happy to answer any questions that you may have.
Thank you, Mr. Andrade. Mr. Taylor.
Comments. I just want to say thank you for presenting this plan today. One of the things I was very excited to see this plan come to fruition. My favorite part of the presentation is when you showed the before and after pictures. Yeah. And our area is growing tremendously and drastically over the last few years. And we're excited about our return to glory. What you mentioned in the Nissan Wagon Works building, we've got several projects that we're trying to put in place, and the area is growing. It's looking great. And I said earlier, return to glory. And as a native son, I always talk about me being a native son of Winston-Salem, but being a native son of the Southeast Ward. We've systematically seen the southeastern portion of the city decline, but now it's back. And I'm very excited to see what we've done, and I'm excited to see this plan on how we move forward. And I don't know if anybody else has any comments, but I just have to, at this time, move for approval.
Second.
All right, thank you. Ms. Adams, any comments or questions?
Yeah, again, thanks to all of the hard work of staff.
Thank you.
And the community, the citizens that participated in it. Every time one of these come, especially since I've been on the council, I get excited for the communities themselves. I look forward to always when we do the updates now, to see what we had at the beginning. And you know how that goes, the public hearing, everybody's mad. They don't like it. They don't want it. We're trying to tell them what to do. But we tell them it's just a plan. And as the world changes, you got to have a plan. You don't know where you're going if you don't have a plan. And a plan gives people opportunity to give input and to be engaged. Again, I thank you, the department, planning, and everybody that helped make this one another successful one. I've heard about this one from people that I know, and they truly enjoyed the input and the assistance that you gave them for this. Thank you.
Thank you.
If there's no further discussion, those in favor of the motion to approve this and send it to public hearing September 3, please say aye.
Aye.
Any opposed? That's unanimous. Thank you very much. One further quick item, and that is the September committee meeting time. As you'll recall from the Public Works Committee discussion, in order to avoid a conflict with the very active primary day, it's proposed that we move our committee meeting to 6 o'clock the following day, Wednesday, September 11. Is there any objection to that?
Is it a pretty weighted agenda?
It could be, yeah. So it's likely that we could be having a discussion for a while. Hopefully not 8 o'clock like tonight, but, you know.
It's not all about me, but I will need to be somewhere at 7, but yeah, I'm okay with it.
Oh, on Wednesday?
On Wednesday.
Okay. You've got services.
Yeah, exactly.
We'll try to get the key items dealt with before you have to go.
Okay, so I'd move for approval on that then.
Second.
If there's no further discussion, those in favor, please say
Oh,
aye.
we got,
No, not about that, go ahead.
Aye.
All right.
Aye.
Any opposed? That's unanimous. Ms. Carmen?
Just one point, if I may. On G2, B, which deals with the ordinance amendment, we're going to hold that and bring that back with the UDO text amendment. So they're a package deal, basically.
okay.
That was what I was anticipating. Thank you.
Right, I just want to make sure everybody understood that.
Yes.
Thanks for clarifying
Thank
that,
you.
because I'd neglected to take that up independently. But let the record reflect that that is understood. If there's no further business, thank you. We are adjourned.